Hello, I'm Congresswoman Doris Matsui of California.
And I'm Congresswoman Jan Schakowsky of Illinois. We are the co-chairs of the Congressional Seniors Task Force.
Every February, our nation celebrates Black History Month by reflecting on the many contributions and accomplishments of African Americans throughout history. We are thrilled to be joined today by Congressman G.K. Butterfield of North Carolina, who is also chairman of the Congressional Black Caucus. Congressman, thanks for joining us today.
Thank you both for having me today.
As we celebrate monumental achievements of the civil rights movement this year, it also marks the 50th anniversary of Medicaid and Medicare. As we all know, millions of Americans rely on these programs for their health and well-being. Medicare and Medicaid are even more of a lifeline for African American seniors who disproportionately face financial difficulties.
In fact, there was a time when millions of African Americans couldn't get the care they needed in local hospitals. When Medicare was created in 1965, the White House enforced Title VI of the Civil Rights Act to ensure that federal funding only went to hospitals that did not discriminate based on race. Congressman Butterfield, can you tell us a little more about that?
I remember so well when Medicare passed in 1965. It was a very happy day for my community because our senior citizens, many of them for the first time in their lives, got an opportunity to get access to health care. And so the Medicare cards were issued and our senior population started using those cards. But what they did not know is that our local hospital was segregated based on race. And so as they began to present their Medicare cards to the hospital, they were assigned to segregated rooms. Somehow the Department of Health, Education, and Welfare found out about segregation taking place in the hospital in my hometown. And so the HEW department issued an immediate order to the local hospital to stop discriminating on the basis of race. It was a violation of Title VI of the Civil Rights Act that had just passed the year before. Our hospital was very defiant and refused to do it, and federal funding was threatened, and the hospital was reluctant but finally caved in and decided to integrate the hospital and to allow African Americans and others to share the same rooms. I remember it so well.
Today, we face another challenge. Many governors have refused to expand Medicaid under the Affordable Care Act in their states. How has this impacted African Americans and really all Medicaid-eligible Americans?
You know, I'm very excited about the Affordable Care Act. I was on the Committee of Jurisdiction when this passed in 2010. It's going to be transformative in health care in America. One of the major coverage provisions of the 2010 Affordable Care Act, or Obamacare as some people choose to call it, is the expansion of Medicaid. Medicaid eligibility to nearly all low-income individuals. In many states across the country, Medicaid is restricted to families with dependent children. But for the most part, in many communities, single individuals who are healthy are not entitled to Medicaid. But this expansion was intended to bridge the historical gaps in eligibility for adults, and it was envisioned as the vehicle for extending insurance coverage to all low-income individuals, whether they were a family or an individual. While the Medicaid expansion was meant to be national, as you know, about 3 years ago, the Supreme Court of the United States ruled that it had to be optional for the states. We were very disappointed with the Supreme Court ruling because our committee had worked very hard to make it mandatory for the states to expand their program. As a result of the Supreme Court's decision, 23 states have elected not to expand their Medicaid programs, leaving 4 million Americans and 1 million African Americans without access to affordable health care. In my home state alone of North Carolina, 360,000 people fall into the coverage gap. Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane," end of quote. That statement was true then, and it's true today. It is deeply disappointing that Republican state lawmakers have taken steps to block the expansion of Medicaid coverage to millions of uninsured low-income people. These are poor children, they are older adults, and the disabled. As they seek to get health care, they are denied. Health care should be a right. It should be a right for all, not just a privilege for the few. It must be made available to every American, regardless of their income status.
This has been a great conversation, Congressman Butterfield. Thank you for sharing your perspective with us.
Yes, thank you so much. Every day, 10,000 Americans turn 65. By 2030, the number of African Americans over the age of 65 is projected to increase by 104%. That's why we must continue to protect and expand these life-saving programs.
Again, let me thank both of you, Ms. Schakowsky and Ms. Matsui. Thank you so very much. This is a very important discussion to have during this important month of the year, Black History Month. And I hope those who see this take every opportunity to improve their health and pressure public officials and, yes, elected officials to protect and expand Medicare and Medicaid in all of our communities.
Agreed. I hope those listening have learned something new from our talk. If you found it interesting, please share this video through social media, email, or any way you can.
Thanks
for listening.